Welcome to CEO Interviews, a production of Agoracom, in which we take the time to sit down with small cap executives, talk about what's going on at their companies. With us today, he needs no introduction, Steve McAuley, CEO of Empire Clinics, trades in Canada under CBDT. For our friends in the US, EPWCF, and for our friends in Frankfurt, in Europe and Germany, 8EC. It's been a while since we've seen you, Steve. Glad to have you back. How are you, my friend?
I'm good. I think the last time we were together, we were doing a little stroll around the upper levels of the hotel in Toronto in a bit of an interesting format that I thought was very good, very natural. So yeah, glad to be back on again and to reach out to everybody and provide some good updates.
This is our first interview since the grand opening in Etobicoke that you unfortunately couldn't be there because you took some illness precautions for everybody else's sake. Let's talk about that first. I was there. It was fantastic for all the shareholders and there's too many for me to name them all off right now, but who showed up as far as Ottawa. It was unbelievable. What kind of feedback did you get? Because you had shareholders there, partners. I mean, you had the president of Rexall, the president of MDX. You had government ministers there. So let's kind of go through those constituents and the kind of feedback you got from that day and what you've heard since then.
Well, I mean, it was tremendous. And thank you for joining us and being an active participant, sharing videos and photos. It was really, really a great day. I'm very proud of our team for putting together the type of event with the type of professionalism that I'm always looking for. I thought it was run well. The weather turned out to be nice. The formalities of the ribbon cutting ceremony were great, and the feedback from participants and shareholders was tremendous. I was getting it on text messages and WhatsApps and emails and photos being sent to me. The fact that we are getting visibility with the ministries and having literally representation from Premier Doug Ford's office, I think it was Minister Parm Gill who was able to attend, is really a statement, in my opinion. We've been working very hard on positioning ourselves from a government affairs perspective, in the province of Ontario, because we want to be a big visible player, in Ontario and with the ministry. And we're going to spend literally tens of millions of dollars over the next 5 years supporting healthcare and supporting patients in the markets that we serve, starting with the province of Ontario. So I don't think it could have gone any better. We had great support. I think people enjoyed seeing the brand. And when they entered the clinics and saw, the professional standards that we're building to see, Medex Health demonstrating the pilot of the teledermatology system and having Dr. Champagne there as a dermatologist on hand. I think it made it very real for our followers and very tangible. And
they've never doubted it, but seeing is believing, touching and feeling, the product actually got delivered makes such a big difference in everyone's perceptions. Not that anyone thought, I don't know if Steve's actually going to go ahead at these clinics, but I got to tell you, it was fantastic to actually. And by the way, it was unfortunate and a disappointment that you couldn't be there for reasons out of your control. But you know what I thought about afterwards? I said to some people, I go, look, Steve wasn't there and the thing ran like clockwork. And I thought that was a great sign for all shareholders, because you can be there and it didn't skip a beat, which means you've done a fantastic job of building a team capable of executing. And that's huge, because too many small cap companies are in a position that they have to rely on GeorgeCom until they get to a certain position. And that's a real risk. So I thought that was real good.
It is. And it is a testament to the team. They are leaders in their own right. Tenzin, my chief of staff, was there, and Tamara, that a lot of people know in investor relations. Mario and Roberto from Medisure were in attendance.
They were great. We had a great
and Doctors Jordan and Dr. Aviv, of course, leading the Medi Collective.
Superstars.
They did their job. I mean, this is what we're all here to do. And I need to rely on putting great people in the right positions and then get out of their way and let them do what they're supposed to do. And that's what we are, having good fortune to sort of really put in place. Some of it by acquisition, some of it by hiring, but really that organizational development is one of the most important aspects that I work on all the time, because if we're going to become that future company that we want to be, I've got to get great people in the right positions, doing the right job with the right sense of motivation and involvement. And I think we're doing it. And
no, it showed, Steve, it showed, like everybody whoever, from Tenzin to Tamara to the doctors, to love the Medisure brothers, everybody just did an amazing job hitting it out of the park at the thing that they're responsible for. By the way, there's also a pretty big deal to see, we didn't talk about this, but to see the president of Rexall Canada there,
and his executive team
at the ribbon cutting ceremony, and exactly. What did that mean? What did that mean to you? And what does that do to further the relationship with a partner like that? We got many partners in the on the pharmaceutical side.
I mean, I think that really was such an important demonstration of just how far we're taking this. It is not lost on me how important, if Nick Caprio, president of Rexall Canada, very large organization, very prominent in the pharmacy space and healthcare space, will take the time to attend that ceremony along with bringing his executive team members, really for me is what we'd hoped for from the beginning, that we could demonstrate to a great partner like that, as a small cap up and coming company in the healthcare sector, that we deserve to garner that type of attention. We're demonstrating that we can take our assets and our investment dollars and utilize them accordingly and deliver a product. And now that's a product that will live for as long as we want it to live. That clinic, the physicians, that particular postcode and community that we will serve together with Rexall will be a tremendous asset, for us and our public company in the future. It's tangible now, right? Like it's rolling, it's tangible. We're seeing patients every day. As we see patients, we generate revenue. And that just repeats itself every day of the week, over and over and over again. What we're doing though, is we're doing it at scale through continued organic growth in the new openings that are happening right now, the new builds, the pipeline that we have. And we also have the acquisitions that we strategically place in there and bring that into the brand also.
Would it be an overreach? But I got to ask, by the way, because the funny thing is we talk about this with the shareholders and they say, we love your interviews because you always ask the questions that we were thinking of. And I tell her when I put on my shareholder hat, right?
Yeah.
Would it be safe to assume, or would it be an overreach to say that Nick Caprio seeing in action the launch, does that how that accelerates the relationship and more importantly accelerates the, hey, let's do more together, because if you can deliver this, I want to see this everywhere. That's my assumption, but I don't want to put words in your mouth. You tell me what that did for the relationship.
Yeah, you're exactly right. This is really like a public demonstration of the strength of the partnership and the fact that we can deliver and execute as we said that we would. And it really starts to open the floodgates for us with a great partner like that. There are many more opportunities in the Ontario market. We've already talked extensively with them about the Alberta market, because the Alberta market is very important to Rexall. So I would anticipate in 2022 to see an accelerated pipeline with them, along with the other national groups that we're already working with. So I think it bodes well, that I think that their confidence with us is at an all-time high. And we can see them saying, okay, if this is what the professional standard looks like, and we see it over and over and over again with this national brand, imagine what this does for all the communities where we serve patients under the Rexall banner, that we can now add to that delivery of care to improve the delivery of care to patients together, but then also accelerate their business model in that postcode and that community.
Yeah, that's why I saw it. I'm glad you confirmed it, because I don't want to put words in your mouth.
Yeah.
By the way, so you can be there. Not everyone else could be there, but there's more to come. So
Yeah.
what are the
Much
next
more to come?
What are the next couple of launches where we're actually going to be able to see you?
Yeah, I mean, we still have I think next one coming up. We just did Mississauga. I think London, Ontario's on deck next. We've got Etobicoke Lakeshore before year end, and I believe
you're coming in for those.
So I anticipate coming in for London and for the big flagship location at Etobicoke Lakeshore. So between now and year end, the exact dates I don't have on the top of my head, but I know London is really coming along very soon. I think the doctors are targeting December 15th for Etobicoke Lakeshore. And when we do like opening of clinic and sort of the ribbon cutting ceremony, don't have to, tie in, exactly to the same day.
Of course.
But I definitely anticipate those two big locations because they're so important. These are 3,000, 3,500 square foot facilities, a lot of medical doctors and practitioners, really, state-of-the-art build, really, and like I say, I'm referring to them as sort of flagship locations because they really are going to be important for those communities.
All right, so we're going to see you potentially November for London and
then mid-December for Etobicoke Lakeshore.
Yep. So for sure, we're going to be seeing each other again, and it'd be great to have is for all the people who couldn't show up the first time. This is your chance to show up the second time, and for anyone who was there the first time, come to Etobicoke Lakeshore.
Come back and join us again.
Back, right? Why not? Yeah. Right now, and this time, well, with you being there, I think that's going to make an even bigger difference. You being there, everyone having access to you. I mean, we'll do a town hall. Right. I'm saying off the top of my head spontaneously, but we'll do a town hall shareholders meeting while we're there.
Hey, yeah, listen, give me a podium and a microphone and let's get at it. We'll definitely take the questions and enjoy the interaction. Right. We've got a lot to share. We've done a lot of tremendous, work. We've got one heck of a 2022 lining up. And the tangibility of these openings and having doctors in place and seeing patients is a direct correlation to new revenues. There's no lag time in this. That's one of the neat things about what we're doing is when we go live, we start billing, and that translates into immediate cash flows for the overall public company. So
as of now, you've got 5 clinics operational, 7 in development and construction. That's 12.
Yeah.
In acquisition, 8, and we'll talk about those too.
Yep, 2 groups, total of 8. So that puts
pipeline of 21.
That sounds about right. So yeah, we see the 20 very clearly right now. That sort of 5 and 7 and 8, and then what the doctors have under conversation, whether it's Rexall or others, is another 21, and that's just building, right? I mean, we could have this conversation 1 month from now, and that pipeline number is going to be bigger.
All right, so that's exactly why I brought that up. 2022. The way I look at Empire right now is you're now off the starting block.
Yeah,
right? You're now off the starting block and you're running, and the starting block is the hardest, right? Getting off the starting block is hard.
Sure it is.
On it, you're there. Now that you're running, let's talk about 2022. And I'm not going to, obviously I can't ask you for projections or things like that, but
yeah,
given what you've been able to pull off for the end of 2021, and it's not over yet. We're still in the first week of November, so we're not even close to being done yet. What should shareholders look forward to in 2022? Is that the Usain Bolt acceleration? Is that when you hit you're off the starting block and then you hit that acceleration phase around 40, 50 meters?
I mean, as an analogy, I guess I would say yes. We're not going to slow down. And I think one of the big things, I've talked about it previously, but don't lose sight of the fact that, I'll be turning my attention, particularly on the acquisition front, back into the US markets. Although we're adjusting what our current footprint looks like and our current, sort of clinic, service model from the old types of services to what our new profile looks like, we are absolutely going to turn our attention to opportunities in the US. We've got a really nice game plan running in Canada now. I think we really know what we're doing. We're getting, we're executing on our organic growth. We continue to get great opportunities come our way on acquisitions in the Canadian market. And I would expect that will continue in 2022 as well. But we really need to expand into that huge US market and really look at the acquisition opportunities that are out there. And we expect to have, the runway, the capital runway as we go into 2022 to be able to do all of this. And the nice thing about these clinic openings is they become cash flow positive, virtually right away. There's just, because we have such a large patient roster in these communities, because we're leveraging our pharmacy angle, pharmacy alignment, pharmacy partnership, we have a cost structure in our clinic locations that are different than most. And we really see it translate to incredible value going forward. And if we take that same kind of thesis and mandate and apply it to other larger markets, we have a model for tremendous long-term success, which not only drives nice top-line revenue in the way that we're doing it, but if our operating costs, and the largest operating cost will be facilities combined with our labor, but our labor, is really a percentage of billable revenue that comes in. So you really don't get offside on that.
It's variable. It's variable. You're not hiring on 5 people unless you need 5 people. So
yeah, absolutely. And it's just the nature of having medical doctors and practitioners, that you manage. And so I think that everybody should take comfort that, the forecast of our 2022 annualized revenue stream based on these clinic openings, it's real now. And if you look back on our financial footprint historically, you can't even use that as a baseline of what's going to happen in the future. No. Not at all. And our job right now is continuing to tell that story of shift and change. And one of the activities that are taking place right now, so we're going to be able to file our third quarter financials quite soon. We'll be very early. Our deadline is November 30th, and we'll be much in advance of that. But I'm taking the opportunity to really upgrade our narrative in our MD&A to make sure it's a reflection of what we're going to look like going forward, and not a reflection of where we've come from. And people need to realize that this third quarter financial becomes the living document, on CEDAR and Edgar for the next 5 months, because we get into the audit season in the new year, and we won't see fourth quarter and full year financials until towards end of April. So we have to be cognizant as a company that this public filing of the third quarter is really the living document for the next 5 months. And so I'm taking the opportunity to make sure our storytelling reflects what we're going to look like in 2022.
And by the way, okay, I'm going to take a quick diversion there.
Sure.
And then come back, because I want to talk about US. I really want to talk more about that. But I've seen on Agoracom, on our Twitter, for example, a couple people say, hey, we got these 2 acquisitions taking place. We're in November. Are we going to close these here in Q4 and then have the same problems that we did last year? Because we made those 2 great acquisitions, right? You did.
Yeah. So, I mean, as we look at our current phase of due diligence with both transactions, and really the process of getting to definitive agreements and closing, and also tax considerations for the parties that we are acquiring, it will be more prudent for these transactions to close on January 1st than say December 31st.
Nice.
We just think that for tax reasons for them, just looking at our timing window, and if they defer or roll over to January, then they don't fall into the 2021 audit. And so there's a few reasons that it's probably prudent. That'll be, whatever January 1st through January 5th or 8th or 10th, I don't know. But we've set the expectations with the parties, with our counsel on both sides. So as I sit right now and I look at it, that seems to be the sort of timing window that we think we're going to work toward.
Right, and that's good news. The last thing you want is to be a victim of your own success by having deals.
Yeah, we have to pay attention to where we are and make some good choices and decisions about this. And that's what we do. We're thoughtful. We're thoughtful about what we're doing. We try to communicate, openly and early with whatever parties we're engaged with, and set the right expectations.
So going back now, so that's great.
Yeah.
I want to make sure, because since we're on topic, I said, let's divert for a second. This US growth that you're expecting for 2022. So I guess safe to assume the two doctors and the team can take care of Canada now.
Yes.
Clearly, even if it means expand to other provinces like Alberta, and you've actually mentioned some other provinces.
Yes.
Places. What do you, generally speaking, what do you think your strategy is for the US? Because it's a big country. So are you going to acquire 5 clinics in Texas, open 3 clinics in Florida, or are you going to try and go regional where you're saying, hey, we'll move northeastern seaboard or west coast? Or is it too early to tell? You just know you're going there?
So, I think it's a little bit too early to identify or comment on specific targets. I would say that it will probably the approach will feel more regional. Again, we have to be cognizant of, as we roll up very fragmented markets, we have to be careful to not be all over the map, literally and figuratively, that it becomes a management nightmare. And
that's why I asked, because
and so
the US is a big country.
Yeah, and I was witness to this and participant, of it in my Penske automotive days when we were rolling up car dealerships. It really doing one-offs in remote regional locations for the sake of doing a one-off ends up becoming a real burden from a management standpoint, and that burden translates into expense. So we have to be, again, thoughtful and prudent. The regional approach makes sense. We're already having very interesting conversations with some significant healthcare experts, real seasoned, experienced people in tremendous markets in the US, and really starting to advance that pipeline and let the US market know that our public company are open for business. We are looking for expansion targets. We are good at M&A. We're good at deal flow. We're also known for execution. If we get involved and the terms work out, what we're known for is taking that term sheet and that non-binding letter of intent structure and translating it into a close, barring any unforeseen due diligence things that may come up. But generally speaking, if we start, we get it done.
Can you comment on this? Are you, knowing you, are you already looking at some specific things in the US? Or
yeah, absolutely. Yeah. We're looking at clinic, health center type opportunities. We're looking at tech opportunities. We are not losing sight of the importance of healthcare technology assets that could be accretive to the, everything that we're doing in the public company. And, but you have to, you just have to look at deals, and you have to try to look at a lot of them. And not all of them make sense. Sometimes they might make sense, but the valuation, ask doesn't make sense. But we're pretty good, as I've said before, I've got a methodology on looking at deals. I've got a process that I follow. I tend not to deviate from that process, and I think that it serves us well. And so I think everybody should be aware that I've absolutely got my sights getting back into the U.S. markets, having a lot of really interesting conversations already, so that as I get into 2022, we can start nailing some new opportunities in these great markets.
Well, you're making me look good because I keep saying the same thing, and I'm pretty sure I said a few times at the opening. Steve doesn't know how to play small ball.
Oh gosh, no. We can't just sit idly by. We are nowhere near our objectives for the future. We have made a lot of changes, some shifts, some pivots. We continue to make sure that we clean up, our back office. We are filling gaps, organizationally. I want us to look and feel and behave like a NASDAQ listed company, long before we get there. And that's what will give us the best opportunity to succeed when that uplist opportunity comes along and we pull the trigger on it.
You just love dropping that in, just because you're going to bring me right in, Tasha. So you've got, it almost seems like you've got a Gantt chart sitting somewhere, which has Canada, US, actually should be here, Canada, US, and then NASDAQ and uplisting and so on and so forth. So you've already got that all mapped out.
Yeah, we do. We've been working on this. I've been working on this not just now in 2021. I started thinking about this and working on it back in 2019. And we have made technical structural changes that allow us, when the time is right, to be eligible, because you have to tick all these boxes in order to be ready. You don't just sort of knock on the door of something like a NASDAQ and say, okay, well, what about us? There's a lot of technical work and structural work that must be in place to meet the guidelines when you apply to the exchange for that uplist. So we meet all the guidelines. With the exception right now, we don't have the share price threshold. I hope we get there organically when the time is right. But there are some technical things that we can do to, be ready for that, checking that box if we need to. We meet all the registration, accounting guidelines. We already do our financials to PCAOB standards and IFRS. So, we're thoughtfully taking the steps to prepare. But organizationally, we're not quite ready, but we're not far off, and we're going to keep getting ourselves ready so that when the time is right, when the markets are right, when our environment is right, I can make a recommendation to our board and that the time is ready to go, and we'll pull the trigger on it.
I love the fact that it's almost clear as day watching you, and I think people can pick it up. You've already got it all mapped out.
We do.
You've got it mapped out. You know what needs to be done and what still needs to be done. And yes, when that day comes, when that 0 day comes, you're going to have all the boxes checked. So that's exciting. That's why I want to have this conversation about 2022. And I know you can't be more specific, and for everyone home, trust me, I'd love to drill down more on Steve, but I also know where my limits are in terms of exchange regulations and all that.
Yeah, so, exactly. Yeah.
But it's great to know that there's a plan.
There's absolutely has to be a plan. You can't, this just doesn't happen. You have to be incredibly thoughtful, very, process oriented. You have to fill these gaps. We have to have the board structure. We have to have the team structure, the leadership structure in place to get there. And our goal is not just to get there, but our goal is to thrive when we get there. There's a reason that we want to go to these larger markets, and that is that we can access the 10 times larger investor base in the US markets, the institutional investor base that is so much more significant. And so we're having these conversations already. I'm talking with New York and the bankers in New York, again, laying groundwork, getting feedback, not trying to do this in isolation, and really looking at best practices and how do we position ourselves early and get on people's radar early that, you know, we're an up and comer, but we're coming. And so pay attention to us now, because we believe we deserve to be there and thrive when we get there.
And I think that's going to be your rightful place. Just, you're great. Like the CSE is great, and Canadian small cap exchanges are great, but you know, you're like a startup CEO that's already had a successful exit. Then you start again in Silicon Valley, but you know you're going to end up on the NASDAQ, and that's definitely your rightful place. Last question for you, which is, we don't talk about Medisure a lot. But they seem like they're hitting it out of the park over there, right?
They are really
how happy you are with the progress they're making such a short amount of time under.
Yeah, you know what, I could not be more thrilled with what's going on at Medisure. We're just over 90 days. Their performance is already greater than we even anticipated, than we forecast. They've come off, I guess we're November, they've come off a really nice month in October, really kicking off the fourth quarter, accelerating. We see them already fitting into our culture in such a great way. We have already started to leverage their incredible Health Canada expertise, their medical device expertise, their warehousing and distribution capabilities. We've shifted all of our care inventory to their warehouse to manage. We're distributing our rapid antigen test kits that we're selling in Canada now through them. We just placed another order for a full pallet of rapid antigen test kits because our pharmacy partners are purchasing them like crazy. And so they're just fitting in culturally. They in their own right are performing. And I think as we begin to diversify kind of their product set, we start to get them into, you know, the US markets with FDA approvals in 2022. I think they're going to be a really interesting division of ours. And I could not be more thrilled with the leadership that Mario and his brother Roberto are showing, not just for Medisure, but within the leadership of the public company. And that's what I was really hoping to get from them. And I'm seeing it already.
Well, we had a great conversation in Etobicoke, and I can tell you, they know what they're doing, and they love being inside the Empower team at the same time. It's the booster rocket they needed to take their business. Like, and look, October they are selected to provide diabetes management solutions for British Columbia's First Nations communities. They have to do a pilot with Care Group of pharmacies. And when it struck me when you said earlier it hasn't been 90 days. It seems like it's been so much longer.
Yeah, but it hasn't. It hasn't.
And that fast. And
I love it really is great to see. And I say I could not be more thrilled with how they've started, and the fact that, you know, they're bringing, you know, diversity to our leadership team. It gives me great comfort. You know, these are people that I know that I can turn to and lean on, and they will jump in anywhere. They are willing to jump into anything that we ask them to do. So it's great to have that leadership experience and performance mindset. That's what I like about them. They're hungry as anybody I've seen, and they just get things done. They get it, right? Get things done, perform, and execute.
Steve, this has been a great way to end off the week. It's Friday here, and we'll be releasing this after the close, and I'm sure shareholders are going to be watching and listening to this over the entire weekend. But awesome, and even better is the fact that we're all going to be seeing each other again here
very soon,
and/or December. We're all going to be seeing each other face to face. So thanks for joining us, buddy, and thanks for giving us a really nice outlook on your Gantt chart organization plan for 2022. Sounds very exciting, and can't wait to see it come to fruition.
Good, George. Thank you for the time.
For everybody at home, you've been watching or you've been listening by podcast on Spotify, Google, Apple, your favorite podcast platform. To Steve McAuley, the CEO of Empower Clinics, CBDT in Canada, EPWCF in the US. For those of you who are new to the story, and still we're bringing on new shareholders all the time, start your due diligence at Agoracom, get to the profile page, because this is a big, moving, integrated, world-class health company now. And there's a lot to learn. And then from there, link right over to the Empower Clinics website to do your deep dive due diligence. Thanks for joining us. To all the OGs, to all the loyal shareholders that have been here all through 2021, even back 2020. It was great seeing you guys in Etobicoke, and thanks for joining us. Hopefully you really love what you heard today from Steve. Make sure we see you November, December. Bye. Hey guys, this video is over, but don't forget to help your company by liking it and even leaving a comment below. And then don't forget to help yourself by subscribing to our channel and never missing another great Agoracom small cap video.